My name is Dr. Sein Lwin. I'm a senior consultant from Advanced Brain and Spine Surgical Center at the Mount Elizabeth Hospitals in Singapore. Today I'm going to talk about chronic headache. When the patients suffer the headache for more than 2 weeks or 15 days a month, if more than 3 months, that means that we define as a chronic headache. So when the people having a chronic headache, majority of patients they become underestimate and less pay attention to the cause. The commonest cause of the chronic headache is usually migraine. We also know as that this is not a serious clinical condition, but it may disturb or affect their patient daily activities and personal life. So your headache is intensity, especially the pain intensity, is suddenly changed and then it's getting worse within the short period of time. Then you have to be very careful and take seriously about underlying clinical conditions. There might be due to the bleeding inside the brain, for example the strokes. This is a very serious and it is a life-threatening situation. Another one is a possibility is an undiagnosed slow-growing tumor when it causes sudden bleed inside the tumor itself that make the rising of the pressure inside the brain and causing you the severe headaches. When your headaches suddenly change in the pain intensity within a short period of time, then you have to be very careful about your underlying clinical conditions. Just want you to go straight and consult with the nearest A&E department in any restructured hospital or your family doctors or any doctors around your residence area. For these serious clinical conditions, when they get the diagnosis early, all these are treatable conditions. The main important part is that to get the diagnosis as soon as possible and to stop the bleeding inside the brain. So when you get to the hospital, they will do the necessary investigation to find out what is the cause of the bleedings, and it can be treated either by the surgically or some condition we can treat with a less invasive procedure, like for example endoscopic endovascular blockage of the bleeding blood vessels in the brains. These treatment options are easily available in any hospital in the Singapore. Most of the neurosurgical centers are well equipped with this kind of treatment. And also another condition is a tumor bleed. This tumor bleed is also one of the serious clinical conditions that can make patient disabled and life-threatening situations. Therefore, the diagnosis is important, and all these can be treated either by the surgery or radiotherapy or endovascular or endoscopic treatment. All these clinical conditions can be treated in any neurosurgical centers in Singapore. But all these clinical conditions are quite serious and they need very extensive investigations and intensive treatments. Therefore, the overall cost of each disease conditions may be estimated about 60 to 70,000 Singapore dollars. It may be more than that, depends on the investigations and the intensive treatment for the clinical conditions.